From the town of Tyngsborough, I'm Rony Camille, and this is Entering Tyngsborough for October 2025. In this episode, we talk about substance abuse and how the town of Tyngsborough is working to combat it.
So I think the incorporation of the Community Narcan Program, which is a CNP, is the acronym, which Tyngsborough is a part of, absolutely broke down that barrier. That's why we see it in town halls. That's why we can give kits out at events. It gives us permission to get fully subsidized Narcan in people's hands that need it.
That conversation starts now on Entering Tyngsborough. Maria, welcome to Tyngsborough's Front Porch. Ashley, welcome back to Tyngsborough's Front Porch. For the people that are going to be watching, tuning in, if you could explain who you are and how it all ties into Tyngsborough.
Absolutely. I would love to go first.
Sure, please.
My name's Ashley Pavlakos. I am the town nurse for Tyngsborough. I'm in a pretty unique position because not only am I the town nurse for Tyngsborough, but I'm part of a grant. So I'm allowed to work with the communities of Tewksbury, Chelmsford, and Billerica. Yeah.
How long have you been a nurse?
A nurse. I've been a nurse for, 10 years now. I've been doing community nursing. This will be my 4th year in this position, to be honest with you. So time flies.
And you're from town?
I am from town. I completed some of my schooling at the middle school and high school here at Tyngsborough. Graduated in 2010, then made my way over to UMass Lowell, where I completed my bachelor's degree for nursing there. So very
Wonderful.
local, didn't go too far, and I love what I do.
Wonderful.
Excellent.
Maria.
So I'm Maria Ruggiero. I am the Prevention Program Manager. Now, I'm based out of Tewksbury as well, but I work with the communities of Billerica, Chelmsford, Drake, Tewksbury, Tyngsborough, of course, Westford, and Wilmington. And my concentration is prevention for substances of first use, which we consider alcohol, marijuana, and nicotine. Of course, vaping is in there as well. But what we're doing, I'm on a grant, it's called the Mass Call Grant through BSAS, which is the Bureau of Substance Addiction Services. We're looking at substance use and the bottom line behavior through a trauma-informed health equity lens. And that kind of changes how we do prevention on an overall scale.
Substance abuse is such a big subject here in our community. Tyngsborough is the recipient of the opioid funds. To the both of you, you're a public health nurse, you're
Prevention
assistant. What are the trends are you seeing locally in terms of the opioid misuse, overdoses, and community health impacts?
I'd like to start off hopeful. I would say, based on the data, numbers are getting better, but that comes with a lot of work that has been done in our community already. For at least about 2 years now, we are a community that carries naloxone free to our public.
And that is, the common term is called?
Yes, thank you. It's called Narcan, which I think more people hear of Narcan than naloxone. But I think that all being said, with the work that's been put in to educate our residents, the numbers have been improving. But for trends, I would say we are seeing a lot of the drugs on the streets that are laced with fentanyl, unknowingly to maybe the user or the person, taking that substance, which can lead to, more problems, more addiction. So we are definitely we see that in our communities. But like I said, I'd like to say it's hopeful. We're getting better.
And it's hard when you say that because you have so many families that have already lost so much.
Yes.
So, on one hand, we're very proud of the work that we've done together as a region. On the other hand, we're still very sad and sorrowful for the people who have lost somebody. So, first of all, if somebody is listening or watching this and you have lost someone or struggling, from the bottom of our hearts, we really are sorry and we feel for you. And we'll continue the fight. We will just continue the fight.
How, Tyngsborough and several communities across the Commonwealth have formed these, task force. How did Tyngsborough, establish its own task force on the opioid epidemic?
Yeah, I would say that just a little backstory for the listeners. The opioid funds were awarded to Massachusetts communities, and they opted in to receive them. So Tyngsborough was that. So once the health department found out that Tyngsborough will be receiving these opioid funds to spend responsibly on behalf of our community, I would say the health department really took charge. And talk to different stakeholders in our community. So, for example, in ours, we have police, we have fire, we have the schools, we have town media, we have the library director. We have all these people coming together to address this issue. And I think that would all kind of stemmed from the health department seeing that this is a town-wide problem that we need to come together and work together to help our residents who may be struggling.
And I think what's important is on a regional level, the issues do not stop at the border.
Correct.
So when you have a town like Tyngsborough that has put all of these sectors together, everybody has their own their own responsibilities, their own way that they need to interact and help with the public. But working together on it, then what we have is a full picture. We have a whole picture or a better picture of how we can address these issues. And I think that's what makes Tyngsborough really stand out.
And you mentioned that, and from your perspective, Maria, what roles do the schools, first responders, and health department and other stakeholders play in this coordinated prevention effort?
You want to go?
Sure. The schools are critical. Working with families in the community is critical. I think what's most important is trying to find a way to meet everybody where they're at. Some people have more experience, unfortunately, with overdose and more experience with substance use because it's in their family.
Yes.
Other folks, they might not be aware of something that's going on, or they don't have it in their family. So it's kind of sending the same message and helping to break that stigma. Because if a family is struggling and versus a family who is not, we want them both to understand each other. We certainly don't. We want to make sure that we're doing the same language, have the same language. The schools are important for the social emotional aspect of it, but it's also critical that the parents and the caregivers and the brothers and the sisters and everybody also have that social emotional piece of it. For example, it's not wrong if you have an emotion over something sad that's happened. What we're trying to do is determine how do we handle that is going to support everybody the best way that they can be supported and give them the tools that they need to kind of move on. I don't know if you want to add to that.
I think it's important to have everyone in the community involved because people go to different places. We might capture somebody who comes into town hall. They see our flyers. They can have a conversation. Or there may be a family who goes to the library and they have some resources out there because they participate in our opioid task force. So I think having a message sprinkled around everywhere to meet people where they're at is so important, and it really helps bring that stigma, break that stigma, and it helps people feel, hopefully not alone. Like we're here to help, we're here to support, we're not here to judge. So I think that's important too. Why it's so important to work collaboratively.
I remember when I first started doing this, I can't believe I'm going to say I've been doing this almost 20 years. In the beginning, for example, on the Narcan, we weren't allowed to really pass it out. We would literally meet in parking lots with families that, knew that they needed the Narcan. Now we're at events and we're explaining it to them. We're giving it to everybody, and it's become a social norm to understand what Narcan is for.
When did that shift happen?
Well, 2012, the Good Samaritan Law was passed. So I'm going to say around 2012, 2013, it started to shift a little bit because the Good Samaritan 911 law, in case if you're not aware, is a law that states that if I say I call the police for an overdose, my friend or my cousin or whoever is overdosing in my home, that I can't be prosecuted because I've called for an overdose.
Sure.
There are three things, and oh gosh, I hope I remember the three. It's warrants, weight, and I cannot remember. I always forget that last W. So if someone is called and there's a lot of drugs on the scene, that's going to be a little different. But if I'm using with my friend and my friend overdoses and I call, I can't be prosecuted. So that was 2012. So I'm going to say that started to make the shift. We still have some people that are a little curious, I think would be the word I use about Narcan, because it is something that they're not familiar with. You know, in the beginning, people thought Narcan was going to hurt you. People thought that people could get addicted to it, and that's not the case at all. So that education has really begun to shift, I'd say, over the last maybe 5 or 6 years, where now people just, maybe not expect is a bad word, but they realize, hey, I can go to several places in order to get this. And if I still feel a little shame, or I still feel a little concern, it's not like I have to make a big deal out of it. It's just someone hands it to me and I have it. So I think that's been very, very helpful.
Yep. I'd say too, you know, this funding came federally, so our states got money as well. So I think the incorporation of the Community Narcan Program, which is a CNP is the acronym, which Tyngsborough is a part of, absolutely broke down that barrier. That's why we see it in town halls. That's why we can give kits out at events. It gives us permission to get fully subsidized Narcan in people's hands that need it. I forget what the exact statistic is, but I was talking to one of the first responders, and I want to say like 40% of the overdoses they respond to have already received Narcan already, which is huge. The faster we can get that blood flow back to the brain, it preserves brain health, and it gives that person a better chance at recovery. So I think, I think both of those things have definitely continued or propelled the shift that we've seen.
Agreed.
I just thought of this.
Yeah.
As you mentioned, first responders, when they're going out and you're getting, obviously, you're seeing the data. Is it's affecting everybody on the socioeconomic spectrum, correct?
Absolutely. Absolutely.
Yeah.
It
There are
does not-
no barriers there.
Yeah.
There are no boundaries. It's absolutely everybody.
How does, for somebody that may be listening and, for the first time bringing it, how does one get to that point where, they're in a situation where they're calling 911? How does that happen?
I think the easiest way for me to explain is to talk about maybe alcohol for a minute.
Okay.
Alcohol has been something that's been accepted in our lives, and a lot of people struggle with alcoholism, and they struggle with that, the need for it. I think with the opiates, it can be slightly different in many ways. We can have somebody that's injured, and they literally and actually need the opiate as a pain medicine. And it's not as much anymore. Now the doctors are prescribing it more realistically. You don't want you to be in pain, but we're not going to give you the pain meds for 6 months afterwards, because it's not necessary. Some people or some young people will experiment. And if you experiment, people will say, well, that's a rites of passage. I experimented when I was younger. Well, the difference with the opiates is we have a natural opiate receptor in our brain. So when it's put into our bodies, if you have a pain, the natural receptor will send a very opiate-like substance to the pain. But if we put the actual pills into our body, what happens is, if there's other factors like genetics, epigenetics, so my grandparents could have had addiction in their lives, and my parents said, you know what, I'm not going to do that, but I still have a huge risk factor because of my grandparents.
Wow.
Environmental, if they see it in their community, or they hear about it in their community, and it's put into a positive thing. Well, here, getting rid of your pain is wonderful, and it's made positive. That's a factor that goes into it. So it's more than just trying to take that substance for the first time. Did you want to add anything to that?
Yeah, I totally agree with the points you made. I think everyone's story is different of how they get there. But I think what I would like to add is trauma. People who have experienced trauma in their life are at an increased risk factor to take these medications, take these opioids, which could lead to that slippery slope where they're calling for help.
So the same thing with like alcohol use disorder or opiate use disorder. People never think it's going to happen to them. And when you talk to people who are in recovery, some people realize, oh boy, I have a problem, and some people do not. So that's where we come in with the resources to try to explain to people, you know, where is there a time when you need to be concerned? You know, for me, I always made my stepkids watch everything, and I talk to them about it all the time. And it's just a way to make sure that the same language is getting out, so that people, so if somebody is experimenting, they don't feel as though, oh gosh, I experimented, so now I'm a bad person. You know, when I work with kids in another community, I'll say, you know, what'd you get in here for? And they'll tell me. And then I'll ask them, well, what'd you think of it? And they're shocked. They expect me to say, you shouldn't have done that, you don't do that. Well, we know you already did it, so you're here.
Right.
So, but what did you think of it?
What are the
and
responses?
those kinds of responses and those kind of questions. A lot of kids will say, I didn't like it. It didn't make me feel good. So then you have to look at, okay, well, then why did you do it? Well, you know, I was peer pressured, or maybe some kids will say, I'm internally peer pressured. Nobody has said to me, you have to do this, Maria, but Maria goes to a party or something and says, I want to fit in.
Mm-hmm.
Right.
So it's talking about those conversations about there are other ways to fit in, without saying that there are other ways to fit in. So it's a very individualized conversation.
Mm-hmm.
But kids know a lot more than we think they do. And I think in my case, when I talk to them about it, it feels more genuine. And then once a young person starts to feel somebody is genuine, they maybe, knock on wood, will have a higher comfort level to go to a trusted adult if they start feeling like, wait, maybe this might be something I need to be concerned about.
Right, right.
Interesting. So, in Tyngsborough, you know, we've got this group of people from the various departments. It's not, I wouldn't say it's a one-stop shop, but how are you folks working in the community to connect families with prevention, treatment, and recovery?
Absolutely. I know through the health department we do a ton of different events throughout the year. So, for example, this weekend we're doing a health fair at the Tyngsborough Elementary School.
And I will say, as we are taping this, I know you're saying this weekend, but we are taping this in September, and this will air in October. By then, the health fair will have passed, but that's okay. I'm glad you brought that up.
But okay, so yeah, we do it at events. We talk about it. We have Narcan kits that we've mentioned a little bit today. We'll bring the magnets to educate people on the steps. Well, you know, all these things to just bring awareness to our community and say, hey, we're here. And that can honestly open, I've had tons of people come up to me and start a conversation saying, oh, so-and-so in my life struggles with this. Thank you so much for having this.
Sure.
Or do you know any resources for any recovery centers near us that we can try to call, or, you know, and it's just helping people feel supported and connected. Like we have no problem talking to people and connecting them with something to support them in their journey, because it's a lot for anybody to deal with alone. So I think the message we get out there is you're not alone. We're here to support. Here's our resources. And that. So I'd say community events. And another thing we've been doing is we just, in September, we had our second annual Light the Night Recovery Vigil, which I think is so important.
Yes.
It gives people space for healing, to come together, to grieve together, to remember the loved ones we've lost, and continuing to break that stigma for our community and let them know this affects a lot of people around us, our neighbors, our friends, family. So I think those are the big ways we
Yeah, and it's about making the conversation available everywhere. Like, for example, at a flu clinic.
Yes.
You know, I'll go and I'll help at a flu clinic. I mean, do whatever, you know, maybe paperwork or whatever. But we're there with conversation and the resources. And I can't tell you the amount of times that we were working on another event of some kind, and we just had our resources out, and people would, like she said, come up and say, oh, well, I'm here to get my flu shot, but I didn't realize that we could do this. Could we talk about this?
Yes.
And, you know, the other day I had somebody from another community reach out, and they needed some help, and I just started making phone calls. And in the meantime, they had found themselves their own help, but I know who to call.
Exactly.
And you know, they were all in the same meeting, which was kind of funny because everybody's phone started ringing. But we build all those resources to just let people know this is where it is at any time.
Right, right. I think the biggest thing is just reaching out for support. I think a lot of people are faced with this challenge either personally or they know somebody in their life and they just don't know what to do, where to start. And I think reaching out for support is the first step.
And reaching out and having the resources available
Yeah.
when somebody who is ready to be helped
Yes. Yeah.
reaches out, because it's a very small window.
Yeah.
Addiction is it takes over our bodies. It truly takes over our bodies, and it takes over our brain. But we're still inside. You know, I might be addicted to something, but I am still inside. I'm still that human being. And there's times when if I'm ready for help, that's the time we need to have the resources.
Mm-hmm.
Not next week or not 3 hours later. Then at that moment
Right.
is for that person to feel that I'm very cared for. One story I tell many years ago, District Attorney Marion Ryan had a panel where she had several people up on the stage, and somebody said to one of the girls, "You were an opiate, using opiates for many years. What changed?" And she said, "Well, I would go to the hospital, and people would treat me like I wasn't a human being.
Yes.
And one day I was in the hospital, and a nurse came over. I'm going to get touched up. A nurse came over, and she put a blanket on me, and she touched my hand, and she said, 'Sweetheart, I hope this keeps you warmer.' And she said, at that moment, I felt like a human being again. And that was enough." Now, that seems like something so simple to us, right?
Yeah.
But at that time, that one little moment of kindness changed her entire life.
Powerful.
What you both said brought up one of your guests that you had at the Light the Night Vigil, your main guest speaker, talking about her life and her daughter who ultimately passed away, which leads me to this. You brought it up just now, but what are some of the barriers that people face in getting that help, or just, saying, resources and what have you? Is it
I think
them being overwhelmed,
Denial.
stigma?
Stigma, denial.
It's multifaceted,
Yeah,
right?
it really is.
It's different for each person. But I think the main points would be stigma, denial, cost, transportation. Sometimes, with this disease, some people lose their license and they can't drive. So now they rely on somebody, or they need money for an Uber, and that's another cost. Support. They might feel unworthy. They're not ready. There's a lot of multiple things that can go into that. First initial step, taking that step. And then, like you said, feeling overwhelmed. Like it is, you have so many people telling you what you should do, and it's just hard for
Right.
you to take that step, what you want to do, and find
Because you've
that
already
help.
lost control.
Right.
If you're at this point, no matter what the substance is, you've
Sure.
already lost control. So now you have somebody coming in to tell you how you're supposed to get better,
Yeah.
how you're supposed to fix it.
Yeah.
And it is not a one-stop fits all.
Right.
It's like Ashley keeps saying, it's what's individual.
Yeah.
I think that attitude has definitely changed quite a bit. We still have some space to go. We still have some room to go. But that's why we're out and do what we do. We just continue the fight along.
Right.
What is the role of mental health, trauma, and stress prevention? And why, how do we address, that factor when we talk about, the human element in treatment?
So what is the role? I would say mental health, trauma is probably the number one factor for people who are struggling with substance use disorder. How can we prevent that? I would say just being kind to one another, right, and trying to understand what people might be going through. It's different for everybody. We may not understand it, but we can accept that's what they're going through. And I'd say supporting each other. Like if someone is struggling, to try to connect them to someone they feel trusted to. I mean, maybe sometimes for some people that's not a therapist. That could be a friend or something like that, a family member that's their most trusted, safe space that they can talk to somebody that they may be struggling with, or with something. Excuse me.
And I think what is traumatic for me might not be traumatic for Ashley. It might not be traumatic for you. So it's all individualized.
Yeah.
But in prevention, I find that no matter what we're talking about, whether it be substance use disorder, whether it be bullying or antisocial behavior, or any of those actions that some young children will take when they're struggling, it's all based from the same type of trauma, whatever that individual trauma is. So Maria and Ashley might have the same trauma. Maybe we're sisters and we go through the same thing. She might say, you know what, I'm going to go use. I might say, I'm going to go have pieces of cake. It's whatever that is that helps us feel like we can deal with whatever the situation is. And I think, I know I was brought up that you don't talk about your emotions. If you're upset about something, you don't talk about it because that makes you a weak person. Well, that's not the case. Actually, it's opposite. If somebody is talking about something that's bothered them, that takes a lot of strength.
Yes.
And I don't know that people realize that people that go into recovery, that takes so much more strength than it is to continue doing what you're doing. And it's just getting that message across. If you're not ready, how do we support and help you and keep you to a point that when you are ready for help, that you're in a position where you're going to be able to take it, I think is more
Nicely said.
yeah.
No, I totally.
So what kind of educational programs are the most effective for, young students, families, just general public?
That changes over the years. And the first thing I want to say, too, we put so much on our schools. We put so much on our teachers. I have a lot of friends who are teachers, and it's just a lot. Again, because of the trauma and things that have happened, the social emotional aspect of it is really critical. I'll have kids tell me, we know that drinking alcohol, or we know that vaping is dangerous. What else do you have? Like, we know it, but why shouldn't we do it? And then what should we do if we're peer pressured? What should we do? Because you'll have parents say, well, that's a rites of passage. Well, we're trying to change that thought process. It might be a rites of passage in some people's mind, but that doesn't necessarily mean that it's a healthy rites of passage. And, how else do we get that in? How else do we get that message across? So for me right now, in my next period of time here, is really having people understand that mental health is not a moral failure. Substance use disorder is not a moral failure. It is a disease. Both of them are diseases, and it should be treated as such.
Yeah.
I always thought when I was younger, our brain is like the engine to our car. So it's like without the brain, we don't function. So how is mental health not a disease? Because it affects the brain that runs the car. So it's just trying to have people understand that we're not weak. We're not weak.
Yeah. And I think finding the right curriculums to strengthen that message and deliver it to the school-age kids appropriately is so important to find
without overburdening
right.
the teachers and the school system that already, in my opinion, and I don't know about Tyngsborough, so I don't want to speak out of school, but we don't know what's on their plate. So it's just trying to find that happy medium so that they're comfortable with it and that the adults that are getting the message across understand it and are comfortable with it. Because remember, we were brought up differently. So now we have to change. And not only do we have to help people understand, we have to change our own minds.
Yes.
Sometimes that's not easy either, Yeah.
I mean, all this work can feel so overwhelming, right? What gives you hope doing this work every day?
Gives me hope. Helping people gives me hope. Hearing people's stories, supporting each other gives me hope.
The collaborations, the working groups, that gives me hope. The little kid that comes up and hugs me because they are painting, whatever they were working on. I said, oh, wow, that's awesome. I love it.
Yeah.
That gives me hope. The little look in their eyes when you address them and let them know that they matter, that what they're doing and right then and there, no matter how small it might be, matters. That gives me hope.
Yeah.
At the Vigil, all the parents hugging us and crying.
Gosh.
I mean, everybody had tears in eyes. That gives, although those families have lost so much, using their strength to help other people really gives me hope.
Absolutely.
Because that's not an easy thing to do.
It's so simple. Like you said, it can be a small interaction, and it's that human connection makes this work rewarding. and gives me hope for the future.
If someone listening to this episode is struggling themselves or worried about a loved one, what's the first step they should take?
Sure. I would say first and foremost, if someone is in a crisis, I would say first and foremost, call 911 and make sure that person, loved one, is safe. If it's not a crisis, I would say reaching out for support. So whether that Massachusetts has a state mental health helpline, that would be a great place to start. I've called them myself personally. Very friendly over the phone, very easy to talk to.
Is that 988?
You
Or
could
is the
call
other
988,
one?
but
Yeah.
this is the Massachusetts specific. It's like the behavioral health helpline. If you search that in your engine, the number should come up. And like I said, I've used it before when working with a client. We've called together, and we were able to get that client an appointment with a mental health counselor.
And they're open 24/7?
24/7. So if you don't have like someone in your life that you can, trust and you share your concerns with, that would be a great place to start. Even if it's not for yourself, you can call on someone else's behalf and get some information for them. Yeah.
And how can the community support the work that the folks here in Tyngsborough are doing? Whether the folks are in town or even in the region or even outside the region?
I would say staying informed with what's going on with our opioid task force. A lot of those announcements come out of the health department Facebook or town website. I would say attending events.
Perfect.
And most importantly, I would say just joining us and helping break the stigma and being informed. Understanding that everyone's path is different, but respecting them with dignity. Would be, is a good way to be involved with this. And then, of course, if anyone wants to volunteer or help out, they're more than welcome to reach out to the health department and get in contact.
We're always looking for volunteers.
with one of us.
Yeah.
And we always are, happy to collaborate and work with anybody.
Yep.
Maria, Ashley, thank you for all the work that you do, and thank you for taking the time for being on Entering Tyngsborough today.
Thank you so
Thank
much.
you
We
so
appreciate you.
Absolutely.
Yeah.
And that will do it for this episode of Entering Tyngsborough. You could learn more about your local government by visiting the town's website at tyngsboroughma.gov. For the town of Tyngsborough, I'm Rony Camille. Thanks for joining us, and until next time, wishing you the best of goodbyes.